NASM PES Chapter 2, Part 2. Part 2. NASM Chapter 2, PES Part 2. Functional anatomy. Functional anatomy. Traditionally, anatomy has been taught in isolated and fragmented components. The traditional approach mapped the body, provided simplistic answers about the structures, and categorized each component. Looking at each muscle as an isolated structure fails to answer complex questions such as, how does the human movement system function as an integrated system? Or even, more simply, what do our muscles do when we move during sport? The everyday function of the human body is an integrated and multidimensional system, not a series of isolated, independent pieces. Over the last 30 years, traditional sports performance training has focused on training specific body parts, often in a single, fixed planes of motion. The new paradigm is to present anatomy from a functional, integrated perspective. The new paradigm is to present anatomy from a functional, integrated perspective. The sports performance professional, armed with a thorough understanding of functional anatomy, will be better equipped to select exercises and design programs. While Chapter 2, page. While muscles have the ability to dominate a certain plane of motion, the central nervous system optimizes the selection of the muscle synergies, not simply the selection of individual muscles. The CNS coordinates deceleration, stabilization, and acceleration at every joint in the human movement system in all three planes of motion. Muscles must also react proprioceptively to gravity, momentum, ground reaction forces, and forces created by other functioning muscles. Depending on the load, direction, resistance, depending on the load, the direction of resistance, body position, and movement being performed, muscles will participate as antagonists, synergists, or stabilizers. Though they may have different characteristics, all muscles work in concert with one another to produce efficient movement. Traditional sports performance training and conditioning has focused almost exclusively on unilateral concentric force production. This is a short-sighted approach, as muscles function synergistically in force couples to produce force, reduce force, and dynamically stabilize the entire human movement system. They function in integrated groups to provide control during functional movements. Realizing this allows one to view muscle function in all planes of motion of function throughout the full spectrum of muscle action: eccentric, concentric, isometric. Behavioral properties of muscle. Behavioral properties of muscle. Muscle is the only tissue in the human body that can produce force. Skeletal muscle allows the body to remain upright, move its limbs, and absorb shock from external forces. The nervous system controls the timing and rate of muscle action. The nervous system must work together with the muscular system in order for these movements to occur efficiently. Thus, when speaking in terms of muscle action, it is common to refer to these two kinetic chain systems as the neuromuscular system. Having a good general understanding of how muscle behaves can help the sports performance professional better conceptualize how it acts when it develops tension during movement. Page 37. Muscle has 4 behavioral properties. Muscle has 4 behavioral properties: extensibility, elasticity, irritability, ability to develop tension. The first behavioral property is extensibility. Extensibility refers to the ability of being stretched or lengthened. An individual who lacks extensibility of a muscle will be limited in their ability to lengthen that muscle. Next is elasticity, which refers to a muscle's ability to return to normal or resting length after it has been stretched. Next is elasticity, which refers to a muscle's ability to return to normal resting length after it has been stretched. Muscle is elastic. Much like a rubber band, that can be elongated with stretching and can resume its original position after a stretch is released. In addition, skeletal muscle has a viscoelastic property that allows it to extend and recoil with time. In addition, skeletal muscle has a viscoelastic property that allows it to extend and recoil with time. Another behavioral property is irritability. Irritability means a muscle is able to respond to a stimulus. In the case of muscle stimulus, in the case of muscles, stimulus can be in the form of an action potential coming from an attached nerve or from the impact of external force on a muscle. Finally, a muscle has the ability to develop tension through contraction. The term contraction should be understood as the activation of a force within a muscle to produce an action at a joint. The term contraction should be understood as the activation of a what force within a what muscle to produce a what action at a joint. Current concepts in functional anatomy. It has been proposed that there are two distinct yet interdependent muscular systems that enable our bodies to maintain proper stabilization and ensure efficient distribution of forces for the production of movement. Muscles located more centrally to the spine provide intersegmental stability, support from vertebrae to vertebrae, while the more lateral muscles support the spine as a whole. These systems have been categorized in relation to the trunk into local and global systems. The local muscular system, stabilization system. The local muscular system is comprised of muscles that provide joint support and stabilization. These muscles are present through the core. These muscles are present throughout the core and connect directly to the spine to produce inter- and intrasegmental support for the vertebrae during functional movements. These muscles stabilize the spine to allow the rest of the body a steady place to produce force from. These muscles stabilize the spine to allow the rest of the body a stable place to produce force from. Primarily local system muscles include the transverse abdominis, multifidus, internal oblique, diaphragm, and the pelvic floor muscles. However, stabilization muscles are not limited to the spine. There are muscles in the appendicular skeleton which provide the isolated function of joint stability rather than the movement. There are muscles in the appendicular skeleton which provide the isolated function of joint stability rather than movement. These are generally single joint muscles located to the joint. For example, the muscle of the rotator cuff only crosses the glenohumeral joint. They insert at the proximal end of the humerus and they have poor ability to generate force. Though weak in movement, they have excellent ability to keep the shoulder joint in socket while helping produce the appropriate orthokinematic of the glenohumeral joint. Though weak in movement, they have an excellent ability to keep the shoulder joint in the socket. So when you work out, you're trying to keep your shoulder joint in the socket to keep a healthy shoulder, while helping produce the appropriate orthokinematic of the glenohumeral joint. These muscles are part of the peripheral joint system. A common example of peripheral joint system is the rotator cuff, which provides dynamic stabilization for the humeral head in relation to the glenoid fascia. A common example of peripheral joint support system is the rotator cuff, which provides dynamic stabilization for the humeral head in relation to the glenoid fossa. Other joint support systems include the posterior fibers of the gluteus medius, the external rotators of the hip that provide pelvofemoral stabilization, and the oblique fibers of the vastus medialis that provide patellar stabilization to the knee. The joint support system of the core, or lumbopelvic hip complex, LPHC, includes muscles that either originate in or insert, or both, into the lumbar spine. The major muscles include the transverse abdominis, multifidus, internal oblique, diaphragm, and the muscles of the pelvic floor. A second mechanism of a core stability comes from via the intra-abdominal pressure mechanism, which helps decrease compressive forces through the lumbopelvic region. When the abdominal muscles contract, they push into soft internal organs of the abdominal region. This pushes the viscera up superiorly into the diaphragm and inferiorly into the pelvic floor musculature, increasing intra-abdominal pressure. This pressure results in the rising of diaphragm and contraction of the pelvic floor muscles, creating stability in the lumbosacral joint junction, as well as the intersegmental stability of the lumbar spine. These mechanisms, working in tandem, help to provide optimal stability of the core and are activated when performing the common drawing in movement. Particular fibers of a large movement system, muscle. Particular fibers of a large movement system, muscle are particular fibers of a large movement system. Muscle are positioned in just the right way to produce excellent stabilization forces. Particular fibers of a large movement system, muscles are positioned in just the right way to produce excellent stabilization forces. An example is the vastus medialis muscle of the quadricep group. It has a unique section of oblique fibers that are key stabilizers of the patella, kneecap. This section of muscle is often called the vastus medialis oblique. VMO. Here we go, the global subsystem. The global muscular system, movement system. The global muscular systems are responsible predominantly for the movement and consist of more superficial muscular that originate from the pelvis to the rib cage and the lower extremities. Some of these major muscles include the rectus abdominis, external obliques, erector spinae. Some of these major muscles include the rectus abdominis, external obliques, erector spinae, hamstrings, gluteus maximus, latissimus dorsi, adductors, hamstrings, quadriceps, and gastrocnemius. The movement system muscles are predominantly larger and associated with movement of the trunk and limbs that equalize external loads placed upon the body. These muscles also are important in transferring and absorbing forces from upper and lower extremities to the pelvis. The movement system muscles have been broken down. The movement system muscles have been broken down and described as force couples working in 4 distinct subsystems: the deep longitudinal, the posterior oblique, the anterior oblique, and lateral subsystems. This distinction allows for an easier description and review of functional anatomy. It is crucial for sports performance professionals to think of these subsystems operating as an integrated functional unit. The central nervous system optimizes the selection of muscle groups, not isolated muscles. The central nervous system optimizes the selection of muscle synergies, not isolated muscles. The deep longitudinal subsystem. The major soft tissue contributors to the DLS, deep soft, are the erector spinae, thoracolumbar fascia, sarcotuberous ligament, biceps femoris, sarcotuberous ligament. The major soft tissue contributing to the deep longitudinal subsystem are the erector spinae, thoracolumbar fascia, sarcotuberous ligament, biceps femoris, and peroneus longus. Some experts suggest that the deep longitudinal subsystem provides a longitudinal means of reciprocal force transmission from the trunk to the ground. An illustrated figure in 2.14. The long head of the biceps femoris attaches in part to the sarcotuberous ligament at the ischium. The sarcotuberous ligament in turn attaches from the ischium to the sacrum. The erector spinae attaches from the sacrum and ilium up the ribs to the cervical spine. Thus, activation of the biceps femoris increases tension in the sarcotuberous ligament, which in turn transmits forces across the sacrum, stabilizing the sacroiliac joint, then up the trunk through the erector spinae. Thus, activation of the biceps femoris increases tension in the sarcotuberous ligament, which in turn transmits forces across the sacrum, stabilizing the sacroiliac joint, then up the trunk through the erector spinae. This transference of force is apparent during normal gait. Prior to the heel strike, the biceps femoris activates to eccentrically decelerate hip flexion and knee extension. Just after the heel strike, the biceps femoris is further loaded through the lower leg. Biceps femoris through the lower leg via posterior movement of the fibula. This tension from the lower leg up through the biceps femoris into sarcotuberous ligament and up the erector spinae creates a force that assists in stabilizing the sacroiliac joint. This tension from the lower leg up through the biceps femoris into the sacrotuberous ligament and up the erector spinae creates a force that assists in stabilizing the sacroiliac joint. Another force couple, not often mentioned, consists of superficial erector spinae, the psoas, and the inner unit. While the erector spinae and psoas create lumbar extension and interior shear force of L4-SI at S1, L4-S1, during functional movements, the inner unit provides intersegmental stabilization and posterior shear force as a neutralizer. Dysfunction in any of these structures can lead to sacroiliac joint instability and low back pain. Dysfunction in any of these structures can lead to sacroiliac joint instability and low back pain. The posterior oblique subsystem. The posterior oblique subsystem. The posterior oblique subsystem works synergistically with the deep longitudinal subsystem, as illustrated in figure 2.15. Both the gluteus maximus and the latissimus dorsi have attachments to the thoracolumbar fascia, which connects to the sacrum, whose fibers run perpendicular to the sacroiliac joint. Thus, when the contractile gluteus maximus and latissimus dorsi contract, a stabilizing force is transmitted across the sacroiliac joint. Just prior to heel strike, the latissimus dorsi and the contralateral glutes. Just prior to heel strike, the latissimus dorsi and the contralateral gluteus maximus are. Just prior to heel strike, the latissimus dorsi and the contralateral gluteus maximus are eccentrically loaded. Chapter 2, page 40. At heel strike, each muscle accelerates their respective length through its concentric action and creates tension across the thoracolumbar fascia. This tension also assists in stabilizing the sacroiliac joint. Thus, when an athlete sprints, the posterior subsystem transfers forces from the transverse plane orientation to the sagittal plane, providing propulsion. The posterior oblique subsystem is also of the prime importance for rotational activities such as swinging a golf club, a baseball bat, or throwing the ball. Dysfunction of any structure in the posterior oblique subsystem can lead to sacroiliac joint instability and low back pain. Dysfunction of any structure in the posterior oblique subsystem can lead to sacroiliac joint instability and low back pain. The weakening of the glutes, the weakening of the gluteus maximus or the latissimus dorsi can lead to increased tension in the hamstring. A factor in recurrent hamstring strains. A factor in recurrent hamstring strains. If performed in isolation, squats for the gluteus maximus and pull downs for the pull-ups, the lats will not adequately prepare the posterior oblique subsystem to perform optimally during athletic performances. We need a squat row probably. Fix that. That was the posterior oblique subsystem. The anterior oblique subsystem. The anterior oblique subsystem is similar to the posterior oblique subsystem in that it also functions in the transverse plane orientation, mostly in the anterior portion of the body. The prime contributors are the internal and external oblique muscles, the adductor complex, and hip external rotators. Electromyography of these anterior oblique muscles show that they aid in pelvic stability and rotation, as well as contributing to leg swing. The anterior oblique, the AOS, is also a factor in stabilization of the sacroiliac joint. Page 41. During walking, the pelvis rotates in the transverse plane in order to create a swinging motion for the legs. The POS and the AOS contribute to the rotation. Knowing the fiber arrangements of the muscle involved latissimus dorso, gluteus maximus, internal and external obliques, adductors, and hip rotators emphasizes this point. The anterior is also necessary for functional activities involving the trunk, upper and lower extremities. The obliques, in concert with the adductor complex, not only produce rotational and flexion movements, but are also instrumental in stabilizing the LPHC. The lateral subsystem. The lateral system is comprised of the gluteus medius, TFL, adductor complex, and the quadratus lumborum, all of which participate in frontal plane and pelvic femoral stability. Figure 2.17 shows how the ipsilateral gluteus medius, tensor fascia latae, and adductor combine with contralateral quadratus lumborum to control the pelvis and femur in the frontal plane during a single leg functional movements as in gait, lunges, or stair climbing. Dysfunction in the lateral subsystem is evident during increased pronation, flexion, internal rotation, and adduction of the knee, hip, or all three during functional activity. Unwanted frontal plane movement is characterized by decreased strength in neuromuscular control and the lateral. Unwanted frontal plane movement is characterized by decreased strength in neuromuscular control in the lateral system. The description of these four systems have been simplified, but the human body simultaneously The description of these four systems has been simplified, but the human body simultaneously coordinates these subsystems during athletic activity. Each contributes to the production of efficient athletic movement by accelerating, decelerating, and dynamically stabilizing the human movement system during motion. Functional anatomy of the major muscles. Functional anatomy of the major muscles. So now it's all muscle time. The traditional simplistic explanation of skeletal muscle is that they work concentrically and predominantly in one plane of motion. However, muscle should be viewed as functioning in all planes of motion throughout the full muscle action spectrum. The following section lists attachments and innervations, as well as the isolated and integrated function of major muscle of the human movement system. A review of actions within the following section with respect to pertinent skeletal muscles should make it clear that muscles function in all three planes of motion. Almost done with this chapter. Come on. Movement in the sagittal, frontal, or transverse plane using the entire spectrum of muscle action, eccentric, isometric, concentric. In addition, Table 2.6 shows which muscles work synergistically with each other to produce force, stabilize the body, reduce force, or all three. Sports performance exercise prescriptions and programs become more specific when there is a broader understanding of functional anatomy. A limited understanding of synergistic functions of the human movement system in all three planes of motion can lead to lack of optimal performance, the potential of developing muscle imbalances. Oh yeah, motor behavior time. Fun stuff, motor behavior. Motor behavior is the human movement system's response to internal and external environment stimuli. The study of motor behavior examines the manner by which the nervous, skeletal, and muscular systems interact to produce skilled movement using sensory information from the internal and external environments. Motor behavior is the collective study of motor control, motor learning, and motor development. Motor control is the study of posture and movements with the involved structures and mechanisms used by the CNS to assimilate and integrate sensory information with previous experiences. Motor control is concerned with what central nervous system structures are involved with motor behavior to produce movement. Motor learning is the utilization of these processes through practice and experience, leading to a relatively permanent change in one's capacity to produce skilled movement. Finally, motor development is defined as the change in motor behavior over time throughout the lifespan. This section is limited to a brief discussion of motor control and motor learning. Motor control. To move in an organized and efficient manner, the human movement system must exhibit precise control over its collective segments. This segmental control is an integrated process involving neural, skeletal, and muscular components to produce appropriate motor response. This process and the study of these movements is known as motor control and focuses on the involved structures and mechanisms used by the central nervous system to integrate internal and external sensory information with what previous experience to produce a skilled motor response. Essentially, motor control is concerned with the neural structures involved with the motor behavior and how they produce movement. One of the most important concepts in motor control and motor learning is how the CNS incorporates the information it receives to produce, refine, manipulate, and remember a movement pattern. The best place to start is the sensory information, followed by proprioception, muscle synergies, and sensory motor integration. The best place to start is with sensory information, followed by proprioception, muscle synergies, and sensory motor integration, motor control, and force development. Motor control, force development. Force production is one of the most important factors in regard to the performance of many sports skills. While sports activities are multi-joint dynamic actions that require explosive force production, tasks such as sprinting, jumping, and throwing do not allow athletes the time to elicit maximal strength, but rather requires them to exert as much force as possible in a very brief time. Due to this, rate of force development may be of more importance. Due to this, rate of force development may be of more importance to athletes than maximal strength. So getting quick rate of force development is helpful, better than just strength. Helps you. The ability to exert greater amounts of force in short periods of time appears to differentiate athletes at various levels. Rate of force development is influenced by both neural and muscular determinants. Motor unit discharge rates, which determine the amount and speed of contraction, are vastly different during slow and fast contractions, with rapid contractions involving a burst of muscle activation versus a ramp-like progression as seen during a slow force production. Plyometric and explosive resistance training has been shown to increase rate of force production with an apparent influence on neural mechanisms controlling the speed of contraction. Plyometric and explosive resistance training has been shown to increase rate of force production with an apparent influence on neural mechanisms controlling the speed of contraction. Sensory information. Sensory information is the data the central nervous system receives from sensory receptors to determine such things as the body's position in space and limb orientation, as well as information regarding the environment, temperature, texture, etc. The information allows the central nervous system to monitor the internal and external environments in order to modify motor behavior using adjustments ranging from simple reflexes to intricate movement patterns. This information allows the central nervous system to monitor the internal and external environments in order to modify motor behavior using adjustments ranging from simple reflexes to intricate movement patterns. Sensory information is essential in protecting the body from harm. It also provides feedback about movement to acquire and refine new skills through sensory sensations and perceptions. A sensation is a process whereby sensory information is received by the receptor and transferred to the spinal cord for either reflexive motor behavior or to higher cortical areas for processing. Perception is the integration of sensory information. Perception is the integration of sensory information with past experiences or memories. The body uses sensory information in three ways. Sensory information provides information about the body's spatial orientation to the environment and itself before during and after movement. Sensory information provides information about the body's spatial awareness, spatial orientation to the environment. Sensory information provides information about the body's spatial orientation to the environment and itself before, during, and after movement. It assists in planning and manipulating movement actions. This is sensory information. This may occur at the spinal level in the form of reflex or the cerebellum, where actual performance is compared the intended. It assists in planning and manipulating movement action plans. This may occur at the spinal level in the form of reflex or the cerebellum, where actual performance is compared the intended. Sensory information facilitates learning new skills, as well as relearning existing movement patterns that may have become dysfunctional. Chapter 2, still, 74. Proprioception is one form of sensory afferent information that uses mechanoreceptors from the cutaneous, muscle-tended, and joint receptors to provide information about static and dynamic positions, movements, and sensations related to muscle force, and movement. Proprioception as the cumulative neural input from sensory afferents to the central nervous system. This vital information ensures optimal motor behavior and neuromuscular efficiency. This afferent information is delivered to different levels of motor control with the central nervous system to use in monitoring and manipulating movement. Proprioception is altered following injury. Proprioception is altered following injury. With many of the receptors being located in and around joints, any joint injury will likely also damage proprioceptive components that could be compromised for some time following an injury. With many of the receptors being located in and around joints, any joint injury will likely also damage proprioceptive components that could be compromised for some time following an injury. A thorough rehabilitation program following a musculoskeletal injury normally will contain a proprioceptive component. Much movement is supported by the global muscular system, reinforcing the need for core and balance training to enhance one's proprioceptive capabilities, increase postural control, and decrease tissue overload. Muscle synergies. Muscle synergies. One of the most important concepts in motor control is the central nervous system groups of synergies. This simplifies movement by allowing muscle to operate as a functional unit. Through practice of proper movement patterns and technique, these synergies become more fluid and automated. Muscle synergies in a bench press would be prime movers pecs, pectoralis major, synergists, anterior deltoid, triceps, muscle synergies in a bench press. Stabilizers, rotator cuff, biceps. And now in a squat, prime movers quadriceps, gluteus maximus. Synergies in a squat are hamstrings, adductor magnus, gastrocnemius soleus complex, posterior tibialis. Those were the synergists. And stabilizers, wow. Lower extremity, flexor hallucis longus, posterior tibialis, anterior tibialis, soleus gastrocnemius, lumbopelvic hip complex, adductors, lumbopelvic, adductor longus, adductor brevis, transverse abdominis, gluteus medius, scapular stabilizers, trapezoids, rhomboids, cervical stabilizers. Sensor motor integration. Sensory motor integration is the ability of the central nervous system to gather and interpret sensory information to execute the proper motor response. Sensory motor integration is only as effective as the quality of the incoming sensory information. Quality, good movement. An athlete who trains with improper form delivers improper sensory information to the central nervous system. Sensory motor integration, which can lead an athlete who trains with improper form delivers improper sensory information to the central nervous system, which can lead to movement compensations and potential injury. Thus, proper programs need to be designed to train and reinforce correct technique. For example, an athlete who consistently performs a squat with an arched low back and adducted femur alter the length-tension relationships of force-couple relationships, and arthrokinematics. This can ultimately lead to back, knee, and hamstring problems. Motor learning is the integration of these motor control processes through practice and experience, leading to relatively permanent change in the capacity to produce skilled movements. The study of motor learning looks at how movements are learned and retained for future use. Proper practice and experience will lead to a permanent change in an athlete's ability to perform skilled movements effectively. For this to occur, feedback is necessary to ensure optimal development of these skilled movements. I give the feedback. Here we go. Feedback. Page 76. Feedback is the use of sensory information and sensory motor integration to aid in the development of permanent neural representations of motor patterns for efficient movement. This is achieved through internal or sensory feedback and external or augmented feedback. Internal or sensory feedback is the process of which sensory information is used by the body via length-tension relationships, force-couple relationships, and arthrokinematics to monitor movement and the environment. Internal feedback acts as the guide steering the human movement system to the proper force, speed, and amplitude of movement pattern. Proper form during movement ensures the incoming internal sensory feedback is correct information, allowing the optimal sensory motor integration for ideal structure and functional efficiency. Proper form during movement ensures that incoming internal sensory feedback is correct information, allowing for optimal sensory motor integration for ideal structural and functional efficiency. External or augmented feedback is information provided by some external force. For example, a sports performance professional, a recording device, mirror, or heart rate monitor. This information is used to supplement internal feedback. External feedback provides another source of information that allows for the athlete to associate the outcome of the achieved movement pattern, good or bad, with what is felt internally. Two major forms of external feedback are knowledge of results and knowledge of performance. Knowledge of results is used with the completion of a movement and to inform that. Knowledge of results is used after the completion of a movement to inform the athlete about the outcome of their performance. Knowledge of results. This can come from the sports performance professional, the athlete, or some technological needs. The sports performance professional might inform the athlete their squats were good and ask if they could feel or see their form. By getting the athlete involved with knowledge of results, they increase their own awareness and augment their impressions with multiple forms of feedback. By getting the athletes involved with knowledge of results, they increase their own awareness and augment their impressions with multiple forms of feedback. This can be done after each repetition. After a few repetitions or once, the set is completed. As the athlete becomes more familiar with the desired movement technique, knowledge of results from the sports performance professional should be given less frequently. This improves neuromuscular efficiency. As the athlete becomes more familiar with the desired movement technique, knowledge of results from the sports performance professional should be given less frequently. This improves neuromuscular efficiency. Knowledge of performance provides information about the quality of movement. An example would be sports performance professional noticing that during a squat the athlete's feet were externally rotated, the femur were excessively adducted, and then asking if the athlete felt or saw anything different about those reps. Or, Knowledge of performance provides information about the quality of movement. An example would be sports performance professional noticing that during a squat, the athletes were externally rotated their femur. The femurs were excessively adducting, and then asking if the athlete felt or saw anything different about those reps. Or to get younger athletes to absorb the shock of landing from a jump and not land with extended knees that place the ACL in a precarious position. Tell them to listen to the impact and land quietly, effectively. Tell them to listen to the impact and land quietly, effectively, teaching the athlete to absorb the shock of the landing. These examples get the athlete involved in the sensory process. Such feedback will be given less frequently as the athlete becomes more proficient. These forms of external feedback identify performance errors. This feedback is also an important component of motivation. Further feedback gives athletes supplemental sensory input to help create an awareness of the desired action. It is important to state, however, that an athlete must not become too dependent on external feedback, as this may detract from the athlete's own responsiveness to the internal sensory input. This could alter sensory-motor integration and affect the learning by the athlete and ultimate performance of the new skilled movement. In summary, each component of the human movement system is interdependent. This human movement system must work interdependently to gather information from internal and external environments to create, learn, and refine movements or motor behavior through proprioception, sensory-motor integration, and muscle synergies necessary to create efficient movement, motor control. Then repeated practice incorporating internal and external feedback allows this efficient movement to be reproduced. Motor learning. And cut.